Alright, so welcome again to my final presentation, my speech. As y'all know, for those who don't know me, it's Water Garza. Aaron Garza, for those who do, it's Eduardo. Let's see. Anyway, now for my speech, I'd like to talk to you about why we shouldn't smoke tobacco, cigarettes basically. Now, people may not know that so much harm can come from a little, cylindrical stick, if you want to put it that way. But there have been many related deaths and diseases from smoking. Now, for example, let's say you know somebody from preschool, or somebody, a family member real close, who raised you since you were little, and you grew close with this person. This person has a habit, likes to smoke a cigarette or two occasionally, every 10-20 minutes, and then now this habit turns into an addiction. An addiction turns into a life-threatening situation. A life-threatening situation turns into the inevitable. Soon you find yourself, sitting by their deathbed. You find yourself drowning in tears. You keep asking yourself, why? Why must God take this person right now so quick, so fast? And there's nothing you can do about it. You can only think about, all the information you could learn about smoking, its dangerous, its effects on the human body. And you wonder, why did you not present this evidence to this person when it was a clear problem that could have been avoided? We soon learn to find that a little knowledge about smoking can go a long way. Now, everybody has seen what a cigarette looks like. One cigarette alone has over 4,000 known chemicals. Chemicals that we use at home, household chemicals, chemicals that we use in cars, chemicals that we use in construction machines and the sort. Now, those 4,000 chemicals, 50 are known as carcinogens, and carcinogens are are known to cause cancer in humans. I will read to you a few examples of chemicals found in cigarettes. First example I might show is benzene. Benzene is found in coal and petroleum. Can be used as a solvent in fuel and chemical manufacturing. It is known to cause leukemia in humans. Now, for people that are familiar with process of preserving the dead after they pass, the dead are filled with an embalming fluid called formaldehyde. I'm sorry, I'm trouble pronouncing that word. But it's the same chemical that are found in dead bodies that are helped to preserve the dead bodies for the families to see in the funerals and stuff. Formaldehyde can cause cancer, respiratory, skin, and gastrointestinal diseases. Another chemical I like to present is ammonia. Now, as you may know, ammonia is used in the kitchen, to clean the counter, stove, whatever, and it can also be used in the bathroom to clean the toilets. Next one is tar. Tar is a smoke that fills the lungs. And what people don't know about cigarette smoke is that once the smoke goes into your body, it condenses, and tar found in cigarette smoke deposits into your lungs and causes 70% of the tar buildup. Now, the main reason why people get so addicted to cigarettes is because of the chemical known as nicotine. Nicotine is the addictive chemical found in cigarettes, and is the reason behind smokers' addiction to the stick. The last one I like to present of the many chemicals found in cigarettes is carbon monoxide. Now, carbon monoxide is tasteless, it's odorless, and of course you can't see it because it's a gas. But if you like to, inhale large quantities of carbon monoxide, you might as well sit in your car, clog the exhaust pipe up, and sit in the car with the windows up. So now that we talked about the chemicals found in cigarettes, I'd like to explain to you the effects it has on the body. I like to quote this from QuitStopSmoking.com. According to QuitStopSmoking.com, statistics show that hundreds of thousands of people everywhere die from smoking-related diseases. Nicotine and carbon monoxide combined have the ability to increase your heart rate and blood pressure, strain your heart and blood vessels. Now this can lead to your heart attacks and strokes, your increased heart rate and your increased blood pressure. It also can reduce circulation to your hands and feet, which leads to people having to get their limbs or hands amputated. Another thing is your muscles, your brain, and your body tissue are deprived of this oxygen due to the carbon monoxide buildup in your body. This causes your body and heart to work harder, stronger, and faster for long periods of time. And over time, your airways can swell up, allowing less and less air to travel to your lungs. As well as the effects that happens inside your body, like I explained, some of the effects it has on the outside of your body. Some physical effects that it has is first your hair. Your hair may smell, you may see some stains in it. Your eyes may sting, they may water more, you more often to blink. Your nose, you be more prone to lose your sense of smell. Your skin will develop more wrinkles prematurely, and you age sooner than expected. Your teeth will have stains, you'll build up more plaque, you'll develop the gum disease, gingivitis, and you'll be more prone to lose your teeth earlier than anticipated. Your hands, you may experience cold hands due to poor circulation. Now the other danger of smoking is not only smoking firsthand, but also smoking secondhand. Secondhand smoke is just basically when you're standing next to a person who's smoking. Now 90% of lung cancer comes from smoking. 30% of cancer-related deaths comes from smoking-related deaths. Now the common form of cancer is obviously lung cancer, but other cancers that can form from smoking is your bladder, your kidney, stomach, esophagus, your larynx, pancreas, and oral cancer, which is cancer of the mouth. You will develop a shorter lifespan than those people who don't smoke, and your lifespan will decrease by 15 to 20 years. Secondhand smoke poses a substantial danger to infants, young children. The reason behind that is because the immune system and their body has not fully developed as a grown person is. And so they increase their chances of developing diseases like asthma, ear infection, sudden infant death syndrome, among other diseases. So now that I presented the facts and statistics of what smoke can do to us and other people, it is up to us to make that choice and take that responsibility to think about not ourselves but our others, to live a healthier life and provide a healthy life for others. Not to mention we do not want to end our life shorter than anticipated and leave our loved ones behind.